So now, what are the clinical indications for PIC tube? I'm going to talk about the most commonly clinical situation that encountered where we need to talk to the patient or their families about the need for PIC tube. The first one I'm going to talk about is tracheostomy. And you wonder, what tracheostomy, what this has to do with a PIC tube? So those on mechanical ventilation in ICU that fail to wean, and we anticipate now prolonged weaning process, we cannot keep the ET tube for a long time, although there is no specific period, but usually 2 to 3 weeks, not longer than that. We need to place a tracheostomy. And when we place a tracheostomy, they need a source for nutrition, because now this is anticipated to be prolonged, could take multiple weeks. Then we need a more permanent, more secured source to give this patient nutrition. The patient will be in mechanical ventilation and cannot eat. That's when we talk to the family about PIC tube. And usually this discussion goes hand in hand. When we start talking about tracheostomy, most of the time we talk to the family about the need to place PIC tube. So that's the first clinical indication that we frequently encounter in ICU for those who needs prolonged mechanical ventilation and require prolonged weaning process. When I say prolonged, that means weeks, 2 months, and sometimes longer than that, depends on the case. The second one is stroke and other neurological condition. But I said stroke because it's the most commonly one we encounter, and usually it will be pretty evident to us if the patient will be able to swallow soon or not after a stroke. Usually we consult with speech therapy and get their opinion. If they say this patient needs probably a few more weeks to recover and start to swallow safely again, or longer than that, it's time to talk to the family about PIC tube as well, because for the same reason we cannot keep NG tube that long, and we need a more secure source for nutrition. Now, other neurological conditions, it could be not necessarily be a stroke. Some people, let's say ALS. There is oculomuscular, dystrophy, muscular dystrophy, and other neurological condition, or cerebral palsy, those who cannot safely swallow. The third indication or clinical indication we encounter in inpatients: failure to thrive in patients who can swallow, but they have very poor oral intake for a reason or another, and their appetite is very poor and they need support. So they still can eat, but they need a kind of more permanent and secure source for nutrition to boost their nutrition. So PIC tube also can be indicated. The fourth one, somebody who doesn't have esophagus, let's say esophagectomy from esophageal cancer or obstruction, and they need a source for nutrition. So PIC tube can be a solution for that. These are the main indications that you will encounter in the hospital. The most commonly ones, as I said, this one and this one. But these are the conditions and the scenarios where you need to start thinking about initiating discussion about PIC tube with families or with patients.